Have you ever noticed a pale patch inside your cheek or a red spot along your tongue and simply brushed it off as nothing? Maybe you assumed it was just a burn from hot coffee or a tiny irritation from your dentures. But what if I told you that ignoring that one little spot could quietly cost you everything? It's a chilling thought, I know. But for many adults over 60, this is not a rare story. As we age, our bodies whisper to us in subtler ways. And some of those whispers come from places we rarely pay attention to, like inside our own mouths. That white or red patch you've dismissed for weeks or months might actually be waving a silent red flag. A warning sign of something far more serious than you'd ever expect. Oral cancer. Now, I know the word cancer stirs up a whirlwind of fear, but before that fear turns to silence, let's talk about this openly, calmly, and most importantly, with the power of knowledge on our side. Because today we're going to walk through the signs that often get missed, the science behind those changes, and the quiet stories of men and women, just like you who caught it early, took action and changed the outcome of their lives. And I promise by the end of this conversation, you'll feel more equipped, more aware, and more in control than ever before. So stay with me because this isn't just a video. This could be the moment your life turns in a healthier direction. Let's begin with a simple truth. Oral cancer doesn't always shout. It often whispers through the body with signs so subtle you'd never think twice. One of the earliest signs is called a leukoplakia, a white patch inside the mouth that doesn't go away. Or its cousin, erythroplakia, a red patch that might look irritated but doesn't seem to heal. Take the case of Robert, a 68-year-old grandfather from Michigan. A retired mechanic, he was used to toughing things out. So when he noticed a white patch near the inside of his cheek, he shrugged it off as friction from his partial denture. Weeks passed, then months. It wasn't painful, just there. Eventually, during a routine dental cleaning, his hygienist noticed the patch hadn't changed. She urged him to see a specialist. A biopsy later confirmed it was early-stage oral squamous cell carcinoma. Thanks to that one checkup and a professional who spoke up, Robert caught his cancer early. He underwent a minor surgery, needed no chemotherapy, and today he's cancer-free and back to gardening with his grandkids. The science backs this up. According to the American Cancer Society, the 5-year survival rate for oral cancers caught early is over 85%. But when it's diagnosed late, that number drops sharply to less than 50%. Now, you might be wondering, why do these patches appear in the first place? It all comes down to the behavior of our cells. Inside your mouth, the lining is made of rapidly dividing cells. When those cells are exposed to irritants like tobacco, alcohol, or even poorly fitted dentures, they can begin to change. At first, these changes are harmless, but over time, especially with repeated exposure, those cells may begin to mutate and grow uncontrollably. That's exactly why white and red patches that persist are so important. They're not just cosmetic, they're cellular warning lights. In fact, research published in the Journal of Oral Pathology and Medicine found that nearly 25% of persistent leukoplakias show signs of precancerous or cancerous changes when biopsied. 1 in 4. That's not a small number, and yet so many go unchecked. Let me share another story with you. Maria, a 74-year-old former librarian from Texas, had never smoked a day in her life. She stayed active, ate her vegetables, and went for her walks every morning. But she also had a habit of sipping hot tea boiling hot several times a day. Over the years, her tongue developed a red patch near the side that never quite faded. She assumed it was just heat-related, but during a dental visit, her dentist took one look and referred her for a biopsy. It came back positive for a localized carcinoma in situ, the earliest form of oral cancer. Here's the hopeful part. Because it was caught so early, Maria didn't need chemotherapy or radiation. She had the area removed with a laser procedure and made a full recovery. Her story reminds us that oral cancer isn't just a smoker's disease. It can affect anyone, especially those over 60, regardless of lifestyle. And things like chronic irritation, spicy or hot foods, or even nutritional deficiencies can create vulnerable tissue where abnormal cells may take hold. But there's something else I want you to know. Not all patches are cancerous, and that's a relief. Some are caused by fungal infections, vitamin deficiencies, or simple trauma. But here's the key difference. Those usually heal within 2 weeks. Oral cancer lesions don't. If something stays more than 2 weeks without improvement, that's your cue to act. No panic, no waiting, Just wise action. So if anything we've talked about so far resonates with you, if you've noticed a spot, a patch, or even just a nagging feeling that something inside your mouth isn't quite right, please don't ignore it. You deserve to feel safe in your body, and safe means informed. If this is resonating with you, I'd love for you to comment with your age or where you're watching from. It's wonderful to know we are on this journey together. Let's continue by looking deeper into why oral cancer often goes unnoticed and how staying alert to subtle changes can quietly protect your life. One of the most overlooked symptoms, especially among seniors, is a sore in the mouth that simply doesn't heal. Not a dramatic bleeding ulcer, not even something that causes pain, just a small spot on the inner cheek, gum, or side of the tongue that lingers. You might think it's a canker sore or cut from a tortilla chip, but when a sore lasts more than 2 weeks, it's time to pay attention. That's what happened to Ernest, a 70-year-old retired bus driver from Florida. Ernest had what he thought was a blister on his lower gum. It didn't hurt. It wasn't growing fast. But after 3 weeks, it was still there. He mentioned it offhandedly to his daughter, who insisted he get it checked out. That simple insistence saved his life. A biopsy showed early-stage cancer in the gum tissue. He underwent treatment quickly, and today he walks every morning with his 2 dogs, healthier than ever. The science behind these sores is surprisingly straightforward. When cancerous or precancerous cells begin forming in the mouth, they disrupt the body's ability to heal normally. They resist the repair signals. They grow quietly often, just a few millimeters at a time. That's why even a tiny unhealed sore can hold enormous importance. According to the National Institute of Dental and Craniofacial Research, nearly 60% of oral cancers are found only after they've grown larger than 2 centimeters because the early signs were missed or ignored. And there's more. Sometimes the warning signs aren't visual at all. A persistent feeling of something stuck in your throat, difficulty swallowing, or even a numb patch in your mouth or chin can signal something deeper. These symptoms often surprise people. They don't associate them with oral cancer because they seem so vague, but they're not. They're the body's way of drawing your attention inward. Think of 66-year-old Jeanette, a widow from Oregon. She didn't have a sore or a patch or any bleeding, but for weeks she kept clearing her throat as if something was caught there. Her voice became slightly raspy. She chalked it up to allergies or dryness, but it persisted. When her primary care doctor examined her, he didn't see much, but referred her to an ENT just to be safe. That's where the tumor was found, near her tonsil, tucked out of sight. Because she acted before it worsened, treatment was less invasive and her recovery was smooth. And that brings us to something incredibly empowering. Your mouth is one of the easiest places for a professional to examine thoroughly. Unlike other parts of the body, your mouth doesn't require scans or blood tests to start the process. It just requires observation and a little courage to say, "This doesn't feel normal." That single sentence can change everything. One of the biggest risks older adults face is assuming that unusual changes are just part of getting older. A change in the way your dentures fit, a strange taste in your mouth, a persistent bad breath. These may seem like inconveniences, but when they persist, they may point to something deeper. A study published in the journal Gerodontology found that over 30% of seniors delayed reporting mouth changes because they assumed it was part of aging. But your body is always speaking. It's not about age, it's about awareness. Let's revisit that idea of dentures for a moment. Ill-fitting dentures or rough edges can constantly rub against the same area of soft tissue, creating chronic irritation. That repeated trauma increases the chance that cells will begin to change, especially in older tissue. This is why regular dental checkups are so important after 60, even if you have no teeth left. Yes, you read that right. You still need oral cancer screenings even without natural teeth, because cancer can form on the tongue, the floor of the mouth, the gums, or the back of the throat. Now here's something hopeful you may not know. Many dentists today are trained to perform quick, painless oral cancer screenings during routine cleanings. They'll check under your tongue, around the back of your throat, along your gums, and around the inside of your cheeks. It takes less than 2 minutes, and it can literally catch the earliest signs before they cause damage. So if it's been more than 6 months since your last dental visit, consider this your gentle nudge. Make that appointment, not for a cleaning, but for peace of mind. Because early detection isn't just a medical phrase, it's your lifeline. And I want to remind you of something simple but powerful. You are not being dramatic or paranoid by asking for something to be checked. You are being wise. You are choosing life. You are honoring your years and protecting the beautiful time you still have ahead. If you're still watching and finding these lessons valuable, please comment the number 1 below, just so I know you're still with me. Thank you for your precious time. When it comes to protecting your health after 60, your intuition often knows more than you think. Maybe you felt something unusual in your mouth lately, a tingling on one side, a sudden numbness in your lip or chin, or a strange change in how your teeth line up when you close your mouth. These aren't just minor quirks of aging. They're signals, and they deserve your attention. Let's talk about those changes in sensation because they're one of the quietest but most critical signs of oral cancer. Imagine a light switch inside your body that suddenly stops working in one spot. You touch your chin and it feels slightly dull, or your tongue goes numb on one side. These symptoms might not hurt, but they can mean a tumor is pressing on a nerve. In fact, facial numbness is often linked to something called perineural invasion when cancer spreads along a nerve path. It's sneaky, but early detection makes all the difference. Take the case of Walter, a 73-year-old from New Mexico. He noticed his lower lip felt strange, like he'd just come back from the dentist, and the anesthesia had him worn off. He figured it was his posture while sleeping, but the feeling persisted. Then he noticed his lower teeth felt slightly misaligned. A visit to his dentist led to a referral, which led to a diagnosis of a small tumor pressing on the inferior alveolar nerve. Thankfully, it was localized. A focused surgery and careful monitoring allowed Walter to continue enjoying his retirement hikes in the desert without missing a beat. Now let's consider something that seems even more unrelated: chronic hoarseness. It might surprise you, but oral and oropharyngeal cancers can change your voice. These cancers can affect areas near the vocal cords or cause inflammation in nearby tissues, altering the tone or strength of your voice. If your voice has become consistently raspy or breathy over the last few weeks, especially without a cold or allergy, it's worth bringing up to your doctor. And what about changes in chewing or swallowing? That's another flag that tends to show up when the cancer is further back in the mouth or throat. You might feel like food gets stuck in one spot, or that swallowing takes more effort. Many seniors assume it's just aging or that they're not chewing well enough. But when it persists, it needs a closer look. There's a term doctors use, dysphagia. It simply means difficulty swallowing. But behind that word could be a growing mass in the throat or at the base of the tongue. According to the American Society of Clinical Oncology, dysphagia is one of the most common symptoms in patients with oropharyngeal cancer, especially those over 60. Yet it's often confused with reflux dry mouth or dental changes. That's why documenting how often it happens and when it began can give your healthcare provider the insight they need to help you. One of the most emotional stories I've heard came from a woman named Elaine, 75 years old, who lived in a quiet coastal town in Maine. She began noticing that eating bread or crackers felt different. Dry foods were harder to get down. Her appetite slowly shrank, and she thought it was just part of getting older. It wasn't until she started choking on soft foods like mashed potatoes that her daughter took her to the doctor. After several tests, she was diagnosed with a tumor at the base of her tongue. She cried not out of fear, but regret that she hadn't spoken up sooner. Fortunately, her treatment team acted quickly, and she is now recovering with speech and swallowing therapy, surrounded by love and still walking the shoreline each morning. These stories remind us that nothing is too small to mention. You are not burdening your doctor. You are not overthinking. You are advocating for yourself, and that's one of the most powerful things you can do in this season of life. Now, I want to touch on another subtle but important sign: ear pain. It may seem strange, but persistent pain in one ear, especially without signs of an ear infection, can actually be a referred pain from a tumor in the mouth or throat. This happens because the same nerves serve multiple areas. So a problem in your tongue or throat might echo through to your ear. If you've had one-sided ear pain for weeks, especially along with other symptoms we've discussed, please speak to a professional. Finally, let's talk about prevention and confidence. I know this may feel like a lot to take in, but the beauty of awareness is that it empowers you. You don't have to be a doctor to know when something feels off. You only need to listen to your body and act with care. Oral cancer screenings are simple. No pain, no invasive tests, Just a trained eye, a gentle touch, and a few minutes of time. And for most of us over 60, having one screening a year could be enough to stay ahead of any silent changes. You've worked too hard, loved too deeply, and lived through too much to be caught off guard by something that could have been prevented. Your mouth is not just for eating and speaking. It's a mirror of your health. And every patch, sore change in sensation, or shift in function is worth looking at. Because you matter. Your time, your comfort, your joy, it all matters. So let's promise ourselves this today. We will pay attention. We will not ignore the quiet signs. We will speak up not from fear, but from wisdom. So what was the one lesson today that really hit home for you? Please share one habit you plan on adopting in your life. I would love to hear from you, and so would others who are walking this journey beside you. And if this message helped you, please like this video and subscribe for more warm, empowering content that honors your health, your age, and your story. Here's to living your best life at any age.